You, you can start.
Oh, okay. Thank you, Loreto. Good afternoon, everyone, and welcome to PiXight, our webinar series on imaging and AI innovation in rheumatology. My name is François Bonnet. I am a scientific project manager here at the Medical University of Vienna, and I will be your moderator. Today, in this webinar, we will explore the ethical and legal considerations of using artificial intelligence in imaging research. But before we begin, a quick reminder for our audience. If you would like to ask a question during this webinar, please post it on the YouTube chat. We will try to address as many questions as possible at the end of the session. I am very pleased to welcome our two guest speakers today who will guide us through the ethical and legal dimensions of using AI in medical imaging research. First, it is my pleasure to welcome Stefan Dinges from the University of Vienna. Stefan is a scholar specialized in ethics, governance, and responsible innovation in biomedical research and serves as the ethical advisor of the AutoPiX project, external ethical advisor, my apologies. Today, Stefan will help us understand the key ethical challenges and responsibilities that arise when developing and implementing artificial intelligence in clinical imaging research in a project like the AutoPiX project. I would also like to welcome Ernest Kazain-Pujol from Collective Minds Radiology, one of the industry partners of the AutoPiX project. Ernest is a senior lawyer and expert in privacy and data protection, and will bring the legal and regulatory perspective, discussing the legal framework that governs AI-driven medical technologies, including aspects such as data protection, regulatory compliance, and the evolving European AI landscape. Thank you both very much for joining us today. And without further ado, I would like to start with, we will start this webinar with two short presentations that will help set the stage for our discussions. And first, Ernest will present the legal and regulatory dimensions, outlining how projects such as the AutoPiX project can navigate the complex regulatory landscape surrounding AI, medical data, and clinical research. Afterwards, Stefan Dinges will introduce the ethical considerations in medical imaging research and explain why ethics must be embedded from the very beginning when developing AI-based tools in healthcare. Ernest, the floor is yours.
Yeah, moving to the first slide, I think it will introduce. Thank you for the interaction, Francois, and I will try to be as brief as I can. Hello, everyone. In the AutoPiX project, we want to use artificial intelligence to improve healthcare and rheumatology. But to understand AI, we must understand one simple fact. AI is built entirely from data. Without data, good data, AI becomes useless. Because data is the fuel that makes AI work, we need high-quality, safe data. But we cannot just grab any information we want. As you see on the screen, advancing healthcare and protecting privacy are like two puzzle pieces that must fit together perfectly. If we want good data, we must do things the right way from the very beginning. If we fail to protect personal information, AI will not be trustworthy and everything will fail. Moving to the next slide, we will start by the Privacy 101. What is personal data and why is it important? To protect information, we first need to know the basics and what personal data actually is. And most of we know that a name or phone number is personal data. But the GDPR definition is very broad, and it also includes indirect information about the person. Imagine we erase a person's name from a medical file, but we keep the zip code, the age, and very rare illness information about the patient. If someone puts those clues together, they could figure out who the patient is. And because of that, those indirect pieces of data are still also considered personal data according to the GDPR. We also have another very important concept in the GDPR called a special types of data, which is the health data. And this is a highly sensitive information about someone's health status, and it's also a very broad concept. But because it's so sensitive, the GDPR provides health data a very strong level of protection. But let's explain the privacy golden rules. And moving to the next slide, we will see the most some of the most important golden rules and privacy principles of the GDPR. We will go in more detail in the next slides on the concept of lawfulness. This means we must always have a legal reason or legal basis to process data before we use it. Also, we need to do it transparently. We need to tell people who we are and what are we going to do with the data and why. Also, the concept of purpose limitation, we need to use the data for clear specific purposes. And although there is some flexibility in medical research, this is a clear, important fact. Also, the concept of data minimization. We need to use the minimum data necessary for the purposes and not more than that. And also keep it very secure according to the context, and also follow the principle of accountability. Accountability means we just don't need to follow the rules. We also need to actively prove and document that we are compliant. Moving to the next slide, we see that the data that is used in AutoPiX originates from two different buckets, two different types of origins. One is data that is new, that is collected from now on. This is the prospective data. But also we have another origin, which is the retrospective data. Data that was collected previously for a legal basis, and it's reused in the project with also a legal basis for the purposes of the project. Moving to the next slide, we will go a bit deeper into this. For the prospective clinical trials, these are in the bucket of prospective data. And we always need to have a legal basis that in this case is informed consent because it's a legal requirement. There is a wide range of different legal bases applicable in the retrospective data, when we reuse data. But all of this data originates with a legal basis, appropriate legal basis, most of the time consent, but then it is reused with a prior analysis on the legal basis for this project to be able to train or validate AI lawfully. If we continue in more detail, we see in the next slide also another important concept before we move into explaining how we treat each type of data. And these two concepts, these two big words sometimes, are the concept of pseudonymization and anonymization. That these two types of data are used to protect identities in this project. The first is pseudonymization. Think of this as giving a file a secret name or a pseudonym, like a nickname. The hospital hides the real name and puts a secret code on the file and locks the key away in a safe. The researchers only see the secret code and the research information, but they don't know who the patient is. And this is mandatory when doing research to protect the patient's privacy. Research can be conducted by maintaining the patient's identity secret, but legally, it's still personal data. And therefore, pseudonymized data is still considered pseudonymized data, considered personal data according to the GDPR, and has all the level of protection that is required. The second word or concept is anonymization. In this case, we destroy the key. And we also go beyond that. We use technical measures to minimize the data to reduce the risk of identifying the patient from the health data we have. The risk of anyone finding out who the patient is must be reduced and quantified until we consider that the risk of re-identification is negligible. And also, the data must be kept in a safe environment to protect also potential risks of re-identification. Moving forward to the next slide, we see that in the prospective bucket, the clinical trials require that the data is always pseudonymized. Why we do so? Because it is mandatory by the law that the doctor treating a patient is able to identify the patient if needed, for example, in the case of side effects. But we will see in the next slide that this is a bit more flexible or can be different depending on the scenario with the retrospective data. But it has always the same way of applying, either with pseudonymization or anonymization. The data from the past projects is minimized and all direct identifiers are removed before it hits the AutoPiX projects, applying a privacy filter. The data minimization, the data is minimized to the minimum necessary for the performance of the project. Going a bit deeper into this, the next slide, we will see how this technically works. We have the hospital environment and files, and there the hospital keeps all the data, including the patient name, of course, the medical record. But then we have this bridge, this technical measure, the CM Connect, that prevents identifier information like the patient name to go into the project environment where we share the data to perform this AI training for the performance of the illness. And with this filter, we prevent that data that is not supposed to go into the project repository lands there. Moving forward, it is also important to consider how we protect the repository, how we protect this cloud environment where the data is located. And this is by applying security measures following the highest standards like ISO 27001, but also performing strict access controls, enforcing traceability at all actions conducted, and constant periodic audits and tests on the environment. But this is not enough. We will see in the next slide that we also apply human rules. And it's not only technology. We implement active reminders in the platform to ensure that the users accessing this data behave correctly, and also apply terms and conditions to prevent bad usage of the data and set the expectations. So this is very important to make all in combination the secure processing environment for this research in the AutoPiX project. Moving to the next slide, we see also very important concept for all the patients and the public. These are the summary of the main patient and the data subject rights in the GDPR that the project must ensure that we can execute them whenever they are applied or requested by the patients. So we comply with the GDPR and we protect the patient privacy rights. Moving to the next slide, very important, and paving the floor for my colleague Stefan, we see that it is not only ethics, it's also law. In the EU, the law was implemented to balance innovation and safety in the best way, especially when we do it in environments like healthcare, that there is a high risk of applying AI if we don't apply the necessary measures. And this is a risk-based approach. We need to apply risk measures and risk assessments before we release this AI to be used. And also very important concept is that in healthcare or high-risk types of AI, it's not that it's risky, it's that we need to prevent the risk before using the AI, but the doctor or the human must always be in the loop. This means that the doctor uses the AI to support the decisions, but the AI does not make the decisions alone. It just helps the doctor make the decisions. And finally, I think I will end with this picture, which summarizes this. To wrap up, following these rules, make sure that AI is safe and ethical, and privacy and data protection paves the way for the future of ethical AI healthcare and how to create a secure and safe and ethical AI product that will be used in the future to improve the patient healthcare. And thank you so much, everyone. And Francois.
Thank you very much, Ernest, for this insightful overview of the legal and regulatory framework surrounding AI and medical data in research. I feel definitely smarter about it now, but I would say that it's now time to turn to the ethical perspective, and I am very pleased to hand over the floor to Stefan Dinges, who will guide us through the broader ethical considerations that shape responsible research in healthcare, including in the field of medical imaging. Stefan, the floor is yours.
Thank you very much. Next slide, please. So we are talking about ethical requirements. And first of all, I will give you a short understanding what does it mean doing ethics in this project. And we have an ethical guidance committee, and I want to introduce you also in this board. And then we will look on some models helping us to find an orientation and to be in communication with all the experts from the medical side, from the research side, and also from the patient side. and in AutoPiX also with our industrial partners. And then we have some points of attention, and I gave you a short look, and maybe there's another chance to have some more aspects in our work. Look at tools and guidance, and that's it for the moment, and you will get the slides at all. Next slide, please. So doing ethics means reflecting morality, and that means to look on norms like Ernest has done. So we are in a good connection to all these normative legal aspects. But then we have to talk about values, principles, and also some soft skills like culture, attitude. And that makes it not so easy to look only on data. And so we have also to reflect in our ethical work from the beginning until the end, and maybe over the end of the project, on tasks, on roles, on objectives, values, or conflicts between some of these aspects. And we start with the description, and then we ask in a step of evaluation, how does it works or not? And then, of course, it comes to decision-making processes. Next slide. So we have this ethical guidance committee. We don't double, for example, the work in every project step. We have an ethical approval, and we integrate that in the reflection in a wider scope. And so we can add another definition for our doing ethics. That means organizing responsibility. And this is what we're doing to all project partners, especially with and in contact with the patient organizations. And therefore, we ask all the agents, so who has a conflict, who sees a problem, and inside his responsibility. And then we come together and try to solve it afterwards. The one who has a problem has the expertise to do the solution. And so every partner, and often one person, has more than one role: the researcher and the physician, the probe and the patient, the university and the hospital, and several other levels with the partners. So we want everybody involved in the project to become an ethical agent for ethical issues in AutoPiX. Next, please. So we are like this red stone. We are in between. And of course, we are open-minded. We have awareness. And of course, we have some principles. And I want to introduce you with the next slide. So you see, it's not only on the top. It's not only care, autonomy, safety, justice. It's also, Ernest was talking about privacy. One of the main aspects, principles regarding such an ethical evaluation of socio-technical arrangements means participation and self-concepts of patients, but also of researchers and other partners. And then we say it's harmless, or we can't do that from an ethical point of view. We have always three levels. We are looking on the individual level, we are looking on organizational level, and at the end on a social level. Next slide, please. Here you have Ernest mentioned all them, some special in the GDR PI PR. Sorry for that. Some aspects Ernest was talking about, but just to remind you on these aspects. Next slide. And now we are coming to some differences, or some other perspectives focusing on AI. We are just talking till right now about data management, and therefore AI is a great opportunity to deal with this big mass of data, prospective and retrospective, Ernest mentioned. And of course, it's preparing possibilities of decision making of all the actors involved. Ernest mentioned what is relevant information, and then what is the knowledge we gaining in this process. That's open. And that cannot be done by AI. So we have a base level with a lot of security, and we have some risks. We have to talk about that maybe in the last round. And who can make the decision if this is a significant digital data? And so how can we go on with that? And there, not only the researcher's expertise is important, but also the patient's or the industrial partner perspective is also relevant to solve these questions, talking about the roles and to clarify in which role who is acting with whom. That's a quite necessary thing, and because we are in social relationships. AI is on the data management level an actor, but coming to information management and knowledge management, we have to clarify the human roles in relationship. Next slide, please. So we are coming into complex relation sets, and I want to give you some examples of values and possible conflicts in values, trust and relief. Who should I trust? Only the one who relieves me from pain. And how can Ernest mention that also my personal perspective come in? And this is more than patient data. These are relevant aspects of my value system. And of course, there's on the data level a big security coming on the information, and at the end on the knowledge level, we cannot be sure that the data maybe can be with other tools, not inside the project, make data or persons identifiable. So the one chance is patients with their needs and their suffering become visible inside the project. And the danger is they become exposed with their personal values. And I have heard a lot of things that even with autonomized data, under special circumstances, not inside the research, but afterwards with the results, and yeah, maybe we can re-identify maybe not a person, but groups of patients, and that could be danger over there. So, and all the other things, hopefully you have take care with. I won't go to much in details. The next slide. So we need everybody's awareness, and that's why we're doing this webinar today, to invite you to in which role and being a part of the society, interest in solving such illnesses and in our healthcare system. This is a big role. So welcome with your awareness. Let's talk about conflicts and tensions. They are normal, and better to have a conflict in interests, roles, values than in persons. So that's what is our approach. And so we believe in a learning organizations. That's what we are talking about with data, with law, and this ethical perspective. Yes.
Thank you very much, Stefan, for this insightful presentation and for highlighting the broader ethical considerations that guide responsible research in healthcare, as we like to have it here for the AutoPiX project. I would like now to invite both of you, Ernest and Stefan, for a short discussion where we can explore maybe some of the broader questions around responsible AI development in medical imaging, both from the legal and the ethical perspectives. Perhaps we could start with the following question. From your respective perspectives, Ernest and Stefan, ethical and legal there, what do you see as the most important challenge when integrating AI into medical imaging research projects?
Ernest, would you start?
Okay. Yeah, the most legal and ethical challenges. The first challenge is to understand what is the data and how we protect the data. And from this perspective, also, we need to understand this project requires, as many AI development projects, a huge amount of data. And you need to ensure that you apply the legal basis, as I explained in the presentation, accurately, and you do proper classification and approach each group of data according to the reach, applying technical measures. And that is important. One challenge is also that we have different types of stakeholders and different approaches to this. So we need to harmonize different ways of approaching data protection, because in the end, this project is about collaborating together, merging this data and making AI being trained, learn from this data, and then the part of classification. As mentioned at the beginning of my presentation, it's not only about the legal compliance, but also very important is the object of this webinar. But when this is ensured, you want to do it in a very quality level, because the quality of the data will then determine the output, the quality of the AI, and we need to ensure that this goes hand in hand. So I think that the challenge is this, because when you have multiple sources of data, you are not collecting the data from now on, so you can decide everything from the beginning. You need to be very carefully approach each type of data in different ways, so you harmonize it in a proper manner. Because if you do it purely, the outcome could be bad. Thank you. But I think that also it's very important, the ethical perspective. I think that Stefan can provide us some guidance.
Yeah, as I mentioned, I think from the legal perspective and all the normative standards in the project, we have highest standards. Maybe to go on, I was talking about data management, information management, and knowledge management, and this is not one process. This is an ongoing process, and in this ongoing process, maybe the most secure and safe part is the data management. But in order to gain the best knowledge, we have in the level of information management to involve again the patient, the researchers, maybe not in person, but as a group and as a sample of perspectives. And I think the risk is not to do it, but not to do it. In order to gain a good knowledge management, we have to involve this, and not to do it is risky at this point, because it's an how to say that these are the criteria from data to information, and to involve the patient's perspective and also the people's perspective at this end, to go on their values, and to risk also some ambivalences which AI cannot deal with. So we have this human interaction, this interpretation, in order to come from data to knowledge. And this is for me the sensitive process, and it needs this involvement.
Thank you very much, Stefan. Ernest, please go ahead.
Yeah, going a bit beyond on this, there is a concept that it's mandatory by the GDPR when you process data that could do it in a risky way. And when we mean risky, it's not that we are causing a risk, but we foresee that there could be a risk because we are dealing with sensitive data and doing something that we could not control as easily as the AI development. When we do that, there is the requirement of performing DPIA. It's called Data Protection Impact Assessments, where you analyze all of the risk and apply measures to reduce the risk. And that is something that this project has conducted, and it's conducting in an ongoing process to minimize the risks as they appear or we foresee. And on the AI side as well, the EU AI Act, I will explain it, also requires risk assessment from the fundamental rights perspective of the subjects or patients, as Stefan mentioned.
And exactly this risk assessment is involving other perspectives and solving these questions at that point. So we learned a lot of this risk assessment even in other projects.
For sure, the GDPR actually includes in the requirement of the DPIA, the Data Protection Impact Assessment, the encourage the people conducting the DPIA to gather feedback from the subjects themselves, like the patients. You cannot do it with everyone because it is a very broad public, but you can use, as we do in AutoPiX, patient representatives to gather these insights that we want to have to do the assessment.
Yeah. And maybe Francois, Loreto Carmona and the guys in Spain, they're doing such a great job to give the public some informations with all these aspects. I'm so grateful, and I think that's a new step in quality in such a project because I'm not one of the healthcare workers, and I'm not one of the medical researchers, but it's understandable for me, and so hopefully for the public.
Absolutely. Thank you so much, Stefan. And I think you're referring to the work of InMusk, indeed, that is led by Loreto Carmona within the AutoPiX consortium, who is doing a wonderful job for us. Thank you, both of you, for this, for bringing your perspective into this discussion. This was fascinating to hear as a non-specialist here. It was music to my ear. I will now stop sharing my presentation, and I will directly check into the chat whether there is any question that was relayed. From the YouTube, I don't see any question, unfortunately, at this point. Let me have a final look. No questions. All right.
Maybe
Sorry,
a
yeah.
recommendation in the ongoing process in the project. Let's have another webinar. We have some aspects of risk and chances and challenges, and maybe that would be a second chance to go on further in this process. That was really enlightening today. Thank you very much.
Absolutely, Stefan. So you've all heard Stefan. We will have an upcoming new webinar to further develop this aspect of ethics and legal aspects of using AI in medical research. But for now, this brings us to the end of today's episode. A big thank you to you both, Stefan and Ernest. It was really an honor to host you both while you were sharing your expertise and helping us to better understand the ethical and legal foundations needed for responsible AI innovation in imaging research. And of course, thank you to everyone who joined us today from YouTube. We hope this discussion gave you some insightful knowledge into projects like AutoPiX, who are aiming to develop AI technologies in a way that is not only innovative, but also ethical, transparent, and legally sound. Please stay tuned for more upcoming PiXight episodes and follow AutoPiX on our website and social media channels for future updates. And with that,